Hey there, students! Today, let's dive into an intriguing topic, the politics of free trade and its impact on health. Free trade is a cornerstone of globalization, but is it really good for our health? Let's find out. First off, what exactly is free trade? Simply put, free trade is the exchange of goods and services between countries without restrictive tariffs, quotas, or other barriers. In theory, it leads to more efficient production, lower prices, and greater consumer choice. But how does this all tie into health? One of the key arguments in favor of free trade is that it can improve access to medicines and health technologies. By reducing tariffs and other barriers, essential drugs and medical devices can become more affordable and widely available. For instance, free trade agreements have been instrumental in lowering the cost of HIV medications in developing countries. This has been a lifesaver for millions of people. However, it's not all sunshine and rainbows. Critics argue that free trade can also have negative health impacts, particularly in developing nations. The influx of cheap processed foods high in sugar and fat has been linked to rising rates of obesity and related diseases like diabetes and heart disease. Additionally, local farmers and food producers may struggle to compete with large multinational corporations, leading to economic instability and food insecurity. There's also the issue of environmental health. Free trade often leads to increased industrial activity and transportation, which can result in higher levels of pollution. This can have serious consequences for public health, including respiratory problems and other pollution-related illnesses. So, is free trade good for health? The answer isn't straightforward. On one hand, it can enhance access to vital medicines and health technologies. On the other hand, it can contribute to unhealthy diets, economic instability, and environmental pollution. Ultimately, the impact of free trade on health depends on how it is managed and regulated. Policymakers need to strike a balance between promoting economic growth and protecting public health. This means implementing measures to ensure that the benefits of free trade are widely shared and that the potential downsides are mitigated. In conclusion, while free trade has the potential to improve health outcomes, it's not a guaranteed solution. It's essential to consider both the positive and negative impacts and work towards policies that promote a healthier, more equitable world. Thanks for tuning in, and remember, stay curious and keep questioning. Until next time.